wonder, does every high school have that one coach whose favorite saying is no pain, no gain? Mine did, and back in my days of running track, he wanted me to max out in the weight room. I was a relay runner, so weightlifting, quite literally, was not my strength. But I did try. So hard, in fact, that I landed in the chiropractor's office with my back all out of alignment. She told me to take it easy for a day or two, but when I talked to my coach, he wanted to hear it from a real doctor. Of course, what he meant was a doctor of medicine, an MD, but it would have been really interesting to see his reaction if I'd gone to see an osteopathic doctor, or maybe a naturopathic doctor. What we have is a public who can't even agree what makes a doctor a doctor. Clearly, there's a missing link somewhere. Is it communication? Education? I'd have to say both. Complementary and alternative medicine, or CAM, is a field that is above all misunderstood. It includes chiropractors, naturopathic physicians, acupuncturists, massage therapists, and many other careers. Today, I urge community members to take a stand for CAM. With the next session of the legislature approaching in 2023, College Station residents should waste no time in signing the petition in favor of the bill to force Texas medical schools to incrementally infuse standard core curriculum with CAM education over the next 5 years. A proposal of this nature would be aimed to phase in change, as well as promote awareness about CAM among physicians, especially as they start seeing that other states have already embraced similar policies. Now, sweeping change is bound to bring challenges, but there is a seamless method of integrating CAM that can allow it to be incorporated into existing coursework. This might be referred to as an integrative approach to the time challenge. CAM is a massive subject because, in fact, it's many subjects compiled into one. The goal is certainly not to add a 5th year to medical school. So the most efficient process of integrating CAM, which is the purpose of the 5-year window mentioned in the bill, is to allow institutions to infuse it throughout all 4 years of graduate level education. So an example of how to do this would be introducing first-year anatomy students to the anatomy of acupuncture, and then having an acupuncturist also address second and third-year students, perhaps in a neurology class, more in depth about the techniques that are used specifically. Clinical rotations are also key to any medical education, so CAM would be integrated here as well. In Academic Medicine, Volume 79, Dr. Ben Kleigler and Associates write, "As with other aspects of a multicultural approach to medical education, immersion and other experience-based teaching methods can be invaluable to facilitate an understanding of the differences between conventional and unconventional views of health and illness, and how those can be reconciled." So in other words, medical students can benefit from having a comprehensive base in CAM on which to build on. Sorry, technology. In fact, it can help them be better equipped as they enter doctors' offices and to build relationships between patient and provider. That is one area where CAM has really excelled. Patients like being able to walk into a doctor's office setting and sit down, talk to someone one-on-one, establish a connection, particularly if they're chronic sufferers, talk about their symptoms, talk about their story, and feel like someone has time to listen. Even critics of CAM can see that that's an area where conventional medicine has fallen short. As stated in occupational and environmental medicine, from a doctor's perspective, whatever we cannot cure, we tend to fall short in our other duty to care. And it's not that medical professionals don't care for the welfare of their patients. It's really a matter of, in a modern clinical setting, oftentimes doctors are only seeing their patients for 10 or 15-minute increments. So those attitudes could be adjusted by integrating CAM techniques and the perspectives that those doctors bring to the table. Another benefit of infusing CAM into a traditional medical curriculum would be giving future physicians a broader repertoire to choose from. So here you can see acupuncture procedure, as well as the relaxing effects of massage, and the benefits of chiropractic that can be used to supplement more traditional treatments. I turn now to the story of Courtney Campbell. She was diagnosed with cancer at age 33 and actually rejected chemotherapy because she was hoping to have a family at some point. Courtney turned to alternative medicine methods, specifically herbal supplements, and she went into clinical remission and now has 3 kids. But the truly amazing part of her story is the fact that she cites the key to her survival as being her oncologist. She actually told reporter Bill Briggs that her oncologist, quote, didn't scare me or push me away. Now, Courtney's oncologist may not have been sure that alternative medicine was going to be the solution for her, but she was still able to monitor her through the entire process and to instill confidence and a will to try. And that's really the essence of providing supportive care. It can be just as beneficial for medical students to learn the risks that are associated with popular CAM practices. A lot of patients are turning now to herbal supplements. We see an example in the article, 4 herbal remedies that are potentially dangerous. Rachel Schultz writes about green tea and how it surged in popularity for treating the symptoms of headaches and also as a weight loss supplement. But patients were not looking at the contraindications, and when taken with amphetamines or certain antidepressants, can actually cause high blood pressure and be life-threatening. So that's something that doctors need to be more or better versed on the subject so that they can caution patients. Now, we're all Texans here, and we know that Texans like to boast about our state being bigger and better, but what we can't claim is that we were first, at least not this time. Georgetown University in Washington, D.C. was actually on the forefront of this integrative medicine movement, and you see there a picture of Dr. Aviad Hammurati, who has been a very vocal spokesman for Georgetown's program and the progress that they have seen thus far. He offers a little disclaimer for critics who are quick to say that pseudoscience has no place in the classroom. He actually told reporters of science-based medicine that we're not teaching a belief system, we're not teaching students to practice CAM, we are informing students about CAM. So Georgetown is not jumping on an alternative medicine bandwagon. Really, their goal is just to enable or empower medical students to be familiar with both sides of the issue and comfortable with the alternative medicine debate. And they're not alone. The debate is actually, or rather the integration movement is sweeping the country. Duke Integrative Medicine Center has been very instrumental as well, and Science-Based Medicine also reports that the University of Maryland, University of San Francisco, Johns Hopkins University have all started using facilities with acupuncture and massage and the like. So I return now to ask, what is a real doctor? Now for most, it might be the Hippocratic Oath, first do no harm. But to me, a doctor is not defined by degree, but rather by degree of willingness to talk to patients, to take the time to listen, to step out of the box and keep an open mind. Because a real doctor knows that patients are people. And stepping into a doctor's office is the one place where we don't want to be treated as equals. We want to be treated as individuals. A one-cure-fix-all approach is not the solution that modern medicine needs. I spoke to you of a petition today, and again, I encourage strong support. College Station residents need to take action now and sign the petition in favor of this bill that would force publicly funded medical schools to integrate CAM education within the next 5 years. Because it's our turn to step up, to speak out, and decide that we can stand together for CAM. Thank you. Do have a few reference slides to run through real quick. Again, I appreciate your time, and here are my note cards.